Type 2 diabetes. What is type 2 diabetes? Type 2 diabetes, the most common type of diabetes, is a disease that occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy and comes mainly from the food you eat. Meanwhile, insulin, a hormone made by the pancreas, helps glucose get into your cells to be used for energy. In type 2 diabetes, your body doesn't make enough insulin or doesn't use insulin well. Too much glucose then stays in your blood, and not enough reaches your cells. The good news is that you can take steps to prevent or delay the development of type 2 diabetes. Causes of type 2 diabetes. Type 2 diabetes is caused by several factors, including overweight and obesity, not being physically active, insulin resistance, genes. Overweight, obesity, and physical inactivity can cause type 2 diabetes. You are more likely to develop type 2 diabetes if you are not physically active and are overweight or obese. Extra weight sometimes causes insulin resistance and is common in people with type 2 diabetes. Moreover, the location of body fat also makes a difference. Extra belly fat is linked to insulin resistance, type 2 diabetes, and heart and blood vessel disease. So, to see if your weight puts you at risk for type 2 diabetes, check out these body mass index (BMI) charts. Or you can measure your own height and weight and use the following formula to find out what stage of the condition you are in. This is a reasonable BMI number for men. This is a reasonable BMI for women. Insulin resistance can cause type 2 diabetes. Type 2 diabetes usually begins with insulin resistance, a condition in which muscle, liver, and fat cells do not use insulin well. As a result, your body needs more insulin to help glucose enter cells. At first, the pancreas makes more insulin to keep up with the added demand. Over time, the pancreas can't make enough insulin, and blood glucose levels rise. Genes and family history can cause type 2 diabetes. As in type 1 diabetes, certain genes may make you more likely to develop type 2 diabetes. The disease tends to run in families and occurs more often in these racial, ethnic groups. African Americans, Alaska Natives, Pacific Islanders, American Indians, Asian Americans, Hispanics, Latinos, Native Hawaiians. Genes also can increase the risk of type 2 diabetes by increasing a person's tendency to become overweight or obese. Who is at risk for type 2 diabetes? You can develop type 2 diabetes at any age, even during childhood. However, type 2 diabetes occurs most often in middle-aged and older people. Specifically, you are more likely to develop type 2 diabetes if you are age 45 or older, have a family history of diabetes, or are overweight or obese. Diabetes is more common in people who are African American, Hispanic, Latino, American Indian, Asian American, or Pacific Islander. Physical inactivity and certain health problems such as high blood pressure affect your chances of developing type 2 diabetes. You are also more likely to develop type 2 diabetes if you have prediabetes or had gestational diabetes when you were pregnant. Take a close look at the latest released type 2 diabetes risk factor video on our channel. Symptoms of type 2 diabetes. They include increased thirst and urination, increased hunger, feeling tired, drowsy or weak, blurred vision, numbness or tingling in the feet or hands, sores that do not heal, unexplained weight loss. Symptoms of type 2 diabetes often develop slowly, over the course of several years. It can be so light that you may not even notice them. In particular, many people have no symptoms. Some people do not find out they have the disease until they have diabetes-related health problems, such as blurred vision or heart disease. Diagnosis of type 2 diabetes. Your healthcare professional can diagnose type 2 diabetes based on blood tests. Medicines to treat type 2 diabetes. Along with following your diabetes care plan, you may need diabetes medicines. These may include pills or drugs you inject under the skin, such as insulin. Over time, you may need more than one diabetes medicine to manage your blood glucose. Even if you don't take insulin, you may need it at special times, such as during pregnancy or if you are in the hospital. Moreover, you also may need medicines for high blood pressure, high cholesterol, or other conditions. Management of type 2 diabetes. Managing your blood glucose, blood pressure, and cholesterol, and quitting smoking if you smoke. Those are important ways to manage your type 2 diabetes. Lifestyle changes that include planning healthy meals, limiting calories if you are overweight, and being physically active. This is also part of managing your diabetes. So is taking any prescribed medicines. Work with your healthcare team to create a diabetes care plan that works for you. Health problems for people with diabetes. Following a good diabetes care plan can help protect against many diabetes-related health problems. However, if not managed, diabetes can lead to problems such as eye disease, nerve damage, kidney disease, foot problems, heart disease and stroke, sexual and bladder problems, gum disease and other dental problems. Moreover, many people with type 2 diabetes also have non-alcoholic fatty liver disease, NAFLD. Losing weight if you are overweight or obese can improve non-alcoholic fatty liver disease, NAFLD. Diabetes is also linked to other health problems such as sleep apnea, depression, some types of cancer, and dementia. You can take steps to lower your chances of developing these diabetes-related health problems. Reduce the risk of type 2 diabetes. You can take steps to reduce your risk of developing type 2 diabetes if you have risk factors for the disease. Here are some things you can do to lower your risk. Lose weight if you are overweight, and keep it off. You may be able to prevent or delay diabetes by losing 5 to 7% of your current weight. For instance, if you weigh 200 pounds, your goal would be to lose about 10 to 14 pounds. Move more. Get at least 30 minutes of physical activity, such as walking, at least 5 days a week. When you have not been active, talk with your healthcare professional about which activities are best. Start slowly and build up to your goal. Eat healthy foods. Eat smaller portions to reduce the amount of calories you eat each day and help you lose weight. Choosing foods with less fat is another way to reduce calories. Drink water instead of sweetened beverages. Ask your healthcare team what other changes you can make to prevent or delay type 2 diabetes. Most often, your best chance for preventing type 2 diabetes is to make lifestyle changes that work for you long term. Note: diabetes is a dangerous disease with many complications related to the kidneys, heart, liver, and causes many serious health effects. Understand the causes and prevention of the disease so that you can promptly treat the signs and symptoms of the disease. The purpose is to solve your problem. So be open and ready to experiment. At the same time, choose your strategy, take action and start enjoying the benefits. Reference: Diabetes Freedom, 2 months free solution. Or visit 247naturalhealth.com to all chronic illness information. Link in the description. In particular, if you know Qigong and its miraculous improvements to health, visit falandafa.org. Thank you. I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.